This question is for Dr. Roger Brooksbank. Are local hospitals prepared to handle an Ebola patient here? Is the staff trained to recognize the illness, treat the patient? Do they understand the protocols?
Great question, Howard, and thank you for the question. First of all, I'm an ER doc. I'm lucky enough to work at other hospitals, both big and small. We've gone through a lot of training and processes from all hospitals in the region to make sure that we are as good or better than anybody else in the country. We're lucky enough to have a community of close-based hospitals that work collaboratively together to do that. So I think, yes, we are ready, we are trained, we are ready to do the best we can to take care of patients. As far as recognizing, you heard the infectious disease specialists on the panel talk about this. This is like the flu. This is a virus. But like in medical school, we're taught our first key thing is to get a good history. A good history for us about travel history, exposure to someone with Ebola is going to be key for us. And yes, we've been trained on safety procedures as well.
Thank you.
Since testing for Ebola is potentially an alarming thing to have a result from, do any of you see that is there any likelihood for a need for pre and post testing counseling the way it's done for other kinds of alarming and frightening tests? In other words, should our readiness planning include that kind of counseling in addition to the usual very good access people have to mental health and pastoral care in our community?
That's an excellent question. You know, for a suspect case to show up, that's going to be a very dynamic, fast-moving situation. And there will be physicians that will have contact with that individual in terms of bringing in extra people or counseling or even chaplains. We've considered what would happen if someone was very distressed and wanted their chaplains to talk with them. And so we're looking at ways to have people communicate with that patient without having physical contact, be it by telephone, by video teleconferencing. We have iPads with, you know, video chat that you can set up in minutes. We went through issues like this in the world of HIV a while back, where pre and post test counseling was really critical because we didn't have anything to offer those patients vis-a-vis treatment. And that would be a consideration. I think that's going to fall on the shoulders of the physician that's in the room, and that's just part of what we would do if we give bad news all the time, unfortunately, about diagnoses of cancer or about diagnoses of other diseases that may be difficult to treat, and we would just have to approach that with the same compassion that we would bring forward for other things that we deal with that can be pretty devastating for the people that we give the information to.